Can I ask a question there? So you know the way, like, so your bowel and particularly, you know, your small and large intestine and right down the end of your, you know, digestive tract. If someone does have like Crohn's or IBD or one of those kind of things where it is inflamed and there's aggravation, there's kind of redness and soreness, like two of the biggest anti-inflammatories are turmeric and like wheatgrass or any of these super antioxidant rich foods. Has anyone done any research trying to, when you actually put those, well, I don't know what the technical term
right.
is.
So
you put it in through the back door. There's a nice word for where you go.
Enemas and things like that. I mean, well, first of all,
repository.
Suppository. You take it through the back door and you kind of like just soak it in that and see if it heals that way.
I mean, look,
because the body's an incredible capacity.
No, you're right.
To heal.
And when we're dealing with, you know, certainly in my practice, when I'm dealing with something. So take example, you mentioned specifically colitis. Okay, so that's a condition where there's inflammation in the lining of the bowel. When we put the camera inside and we look at the lining of the bowel, instead of being healthy and pink like your cheek, like the lining of your cheek, really that's what the lining of your large bowel kind of looks like. Instead of looking like that, it looks red and sore and it's got ulcers. It looks like it's been badly sunburned. And then, you know, you're rushing to the loo, you're losing blood and all that sort of stuff. It's very unpleasant. So the first thing we do is we work on the overall healthfulness of the diet. We push people away from processed food and animal products and towards plant-based sources of nutrition, etc. And we use that in more severe cases in combination with these wonderful medications that we have. Like we've got 5-ASA drugs, we've got immune suppressants, we've got biologic drugs. Like the technology is really amazing. But in my practice, like the healthy diet and lifestyle and the medication are equally powerful tools that complement each other. But so that's where the conversation starts, right? But it's interesting you mention that because there are so many kind of traditional medications or foods or extracts, like you mentioned, curcumin. So curcumin actually is one anti-inflammatory compound that's been studied in great detail, specifically in ulcerative colitis. So the condition you asked about, and curcumin is an extract from turmeric, and it's been used in like Ayurvedic and Eastern medicine for a long, long time as an anti-inflammatory. For things like arthritis and headaches, et cetera, et cetera, et cetera. So it has been studied in ulcerative colitis. It's actually incredibly effective.
But my point was that, so if I take it through my mouth orally, like...
Well, there's been studies on both. I
always wondered that, like, you know, the body is super incredible. Like I take it in through my mouth and somehow it knows to go to the sore bit in my gut. Yeah. And it's like, that's assuming that, like, I don't know, the body's an incredible mechanism that you'd almost kind of think that, well, if it's down at the end of if it's easier to go through the back door to get it closer, like, why don't I put it in that way and try, you know, that you're probably going to get a bigger bang for your buck going.
No, you're right. But I mean, it's been specifically for curcumin, we've seen studies. So for ulcerative colitis, for example, we would start with those treatments that I mentioned. You have your basic tablets and sometimes suppositories, enemas, healthy dietary change. And if patients aren't getting better at that point, traditionally, the next step would be to bring in immune suppressing steroids or anti-TNF medications. So these are wonderful medications and they help a lot of people improve the quality of life, but they also come with a significant, you know, certain side effects and everything, and you don't prescribe them lightly. But for those patients in particular, there's been some great randomized controlled trials looking at giving people curcumin. So 2 grams, 3 grams of curcumin per day as it's a turmeric extract, getting maybe 80% of those patients into remission. Wow. And why is that? It's because curcumin targets many of the same inflammatory mechanisms that our modern drugs target. You know, like hitting the same interleukins and tumor necrosis factors and all of these inflammatory signals that our medications are targeting. You can do that with curcumin too, and side effect profile is very, very good. People sometimes get a little bit of abdominal discomfort with it, but it's a very safe medication. But I think a lot of practitioners in the gastroenterology world haven't really looked at that research, you know. But certainly it's something I recommend to my patients with mild to moderate colitis all the time, you know.
Because it's more like almost like a dietary supplement as opposed to, you know, a technological medicine.
Yeah, exactly. And there's plenty of other dietary supplements that are put out there, but there's no evidence to support them. But curcumin's been the subject of several randomized controlled trials endorsed by the European Crohn's and Colitis Organization as a useful treatment for patients with ulcerative colitis in particular, you know.